Hi, today I'm going to show you how to take a skin biopsy for fibroblast culture. A fibroblast cell culture is an important pathology specimen for the investigation of children and adults with suspected genetic disorders. They provide a living cell line which can be obtained from a short, minimally invasive procedure involving local anaesthetic and skin punch biopsy. These cells are easily cultured in vitro and are capable of cryopreservation and reanimation for future use. A fibroblast cell culture can then be used at any time for biochemical investigations such as acylcarnitines and enzyme assays. They can be used as a DNA source for molecular genetics investigations. More recently, they have been used in patient-specific disease research and disease modelling with their ability to be induced pluripotent stem cells with transformation to other cell lines. Good preparation can maximise the success of your cell culture. For planned procedures, please liaise with the biochemical genetics laboratory team at least 24 hours prior to your procedure. Aim to complete any elective procedure in the morning so that the lab can receive the samples no later than 3 p.m. When ordering Empower Chart, please request either primary cell culture or fibroblast culture. Collect your fibroblast culture media from the fridge behind reception in the phlebotomy department, and remember to organise a helper for the procedure. 2 consent forms are needed for this procedure. The first is procedural consent, in which the procedure and complications are to be discussed with the patient and their family. Complications include pain, bruising, bleeding, minor skin infection, and scarring. The cell culture can also fail to grow. This can happen if the media becomes contaminated with viruses, bacteria, or fungi. Please use the Request Consent for Medical Procedure form for this consent. The second consent is for the cell line storage. This is a genetic consent. It is important to advise that genetic information can be gleaned from a cell culture, as the cells have DNA that can be extracted. Samples are generally stored for 10 years, though longer storage can be negotiated with the laboratory in special situations. You will need to prepare a number of items of equipment. These include a dressing pack, chlorhexidine solution or a SoluPrep antiseptic swab, alcohol wipes, 1% lignocaine with or without 1 in 100,000 adrenaline, a 3 ml or 5 ml syringe, a blunt drawing up needle, a 25 gauge needle, a scalpel, a 3 mm skin punch, sterile gauze, steri-strips, sterile gloves of an appropriate size, sterile forceps, we prefer untoothed, sterile scissors, a small bandage, and a fenestrated drape. This is how we prepared for today's demonstration. We used a dressing pack with a drape, appropriately sized sterile gloves, a 5 ml syringe with a drawing up needle and a 25 gauge injecting needle, the 3 mm punch, a scalpel, steri-strips and appropriate dressing, a SoluPrep swab, 1% lignocaine with adrenaline, and the culture medium demonstrated in a sterile pot. A skin biopsy can be collected from most areas. We recommend you choose a healthy patch of skin devoid of visible blood vessels. Commonly used sites include the upper forearm, deltoid region, gluteus, and inner thigh. We will now review the steps of the procedure, starting with the local anaesthetic. In this demonstration, the proceduralist uses a sterile gauze to anchor the skin with their non-dominant hand. An alcohol wipe is then used to clean the skin. The 25 gauge needle and syringe containing lignocaine and adrenaline is then inserted at a 15 to 30 degree angle with the bevel up to provide subdermal and intradermal anaesthesia. A good intradermal anaesthesia delivery is evident by the appearance of a wheal at the injection site. Usually half a ml of local anaesthetic will be sufficient. Patient discomfort can be minimised by pre-application of topical anaesthetic such as MLA Angel and LMX creams, or cold spray. You can slightly stretch the skin with your non-dominant hand. Ensure the anaesthetic is at room temperature. Consider the use of a bicarbonate buffer. Deliver the subdermal anaesthetic prior to the intradermal anaesthetic. Inject slowly and always attempt to verbally distract your patient. After the anaesthetic has been given, please wait a minute or two before moving on to the punch biopsy. We will now prepare the biopsy site. The local anaesthetic used here was lignocaine with adrenaline, hence the area of skin appears slightly blanched. The addition of adrenaline vasoconstricts the blood vessels, which improves analgesic effect and minimises bleeding. The proceduralist cleans the area with the SoluPrep swab, starting from the centre of the intended biopsy site and extending outwards in a circular motion. A fenestrated drape is then placed over the sterile area. It is now time to take the biopsy. The skin biopsy is performed with a 3mm punch. The forceps, scalpel and gauze are also prepared within reach. The punch is placed perpendicular to the skin and is applied to the skin with moderate pressure and a screwing motion. Stop pressure when you feel the resistance from the skin lighten. You will often see the skin rise against the cutting surface when the epithelium is breached. Forceps are then used to gently grasp the specimen, ensuring not to crush it. The scalpel is used to separate the specimen from the fascia. Please ensure that you cut away from yourself. Apply gentle pressure to the wound with the gauze. Check that the specimen is within the forceps and pass these to your assistant or place them in a safe, sterile area. Now to apply the dressing. Most often, sustained pressure for a few minutes will achieve adequate hemostasis. When you are satisfied, apply an appropriately sized Steri-Strip to the wound with a little tension, aiming to bring the edges together. Then apply an appropriately sized clean dressing. A Tegaderm or Cutiplast are most commonly used. If the wound is still bleeding or oozing, light pressure can be applied to the dressed biopsy site with a crepe bandage. Ensure that your specimen has been appropriately stored. Ideally, your assistant will have immediately placed the specimen in the tissue culture medium. However, it is easy for the sample to be missed. So please double check your forceps and check that you can see the specimen within the culture medium before sealing the tube tightly and labelling with a pathology patient label along with the date and time of collection. When you have completed the procedure, please provide the patient with the skin biopsy and aftercare information sheet and discuss aftercare. For ongoing oozing and bleeding, direct pressure can be applied. If the bleeding persists, the family should call the on-call team for advice. The dressing and wound must be kept dry for 2 days. The top dressing can then be removed, leaving the Steri-Strips in place. The wound can now be wet, but should be patted dry. Steri-Strips will fall off in 7 to 10 days. You may trim the edges of the Steri-Strips as they lift for comfort. If the Steri-Strips do not fall off, they can be gently removed with warm soapy water. If the wound or site become red or swollen or hot to touch, the patient should be seen by their GP. The site may be uncomfortable for 2 days. For this, paracetamol may be used. If this discomfort persists beyond 2 days or there are other concerns, the patient should see their GP. Thank you for joining me in our instruction for how to complete a skin biopsy for fibroblast cell culture. Further information about how to complete this procedure can be found in many references. Some are included here.